Episode 2, Customer Experience Management Framework, a strategic overview. Let me ask you something. When was the last time you looked at your hospital or clinic through a patient's eyes? Not just a clinical journey, but their entire experience. For many organizations, patient experiences just happen randomly. But the truth is, the great experiences are not accidents. They are designed, they are crafted carefully. And that's exactly what customer experience management is all about. It gives us a structured way to build better patient experiences. Instead of reacting to the complaints or the reviews after the fact, we can actually shape what patient feels at every step. And here's the good news. We have a proven framework for this. A simple 5-step process that your hospital, clinic, or wellness business can use it. The step number 1 is to analyze patient experiences. Here we map their real journey, understand their emotional pain points, and listen deeply. Step 2 is to build your experiential platform. This is your promise to patients, which should be clear, simple, and powerful. And the step 3 is to design the experience. Every touch point matters. Let it be your website, reception, consultation rooms, and follow-up. The step 4 is to structure the delivery of care, to align your people, process, technology, so the experience is smooth, consistent across the touch points. The step 5 is to continuously innovate. Patient expectations are evolving fast. Remember, customer experience is never a one-time exercise. It is a continuous innovation and improvement. Let's deep dive and understand 5 steps of customer experience management framework with an example. Here, for an example, let's take a couple, parents-to-be, who are looking for the right hospital to have their first baby in a new city. Here, the step 1 is to analyze patient/the customer experience. What we do in this step is we map customers' real journey, we understand their pain points, we listen deeply. Before improving the experience, start understanding exactly what couples go through during their decision and care journey. The couple first step might be at late night Google search with a keyword best hospital for delivery near me. They might visit multiple websites, call few reception desks, ask for friends, scroll through reviews, and compare cost. Their emotional journey swings between hope, anxiety, confusion, and excitement. Now, as a result, the couple might have shortlisted 2 hospitals. The one gives them a warm, informative response over the call, follows up with a personalized WhatsApp message explaining the birthing packages. And the other could have been like this. The other gives a rushed answer with no follow-ups, and guess which one they would trust more. Therefore, map patients' customers' journey step by step. Talk to the real patient, shadow them, use data from calls, reviews, and digital channels to uncover the real pain points. Step 2 is to build your experiential platform. Define your promise. It should be clear, simple, and powerful. Your patient promises is the North Star, guiding every touch point, shaping every interaction, and defining the experience. For a maternity hospital, this could be something like, we promise every couple a journey that is caring, transparent, and deeply personal. This promise isn't a slogan. It is the lens through which every decision is made clinically, operationally, or digitally. For example, if your promise is caring and personal, then even a billing conversation should reflect that empathy. Your staff shouldn't treat parents to be like a transactional IDs. They should treat them like families to be. Now, let's understand step 3, that's to design the experience. Every touch point matters, from website to reception, consultation room, and even follow-ups. Once the promise is clear, you design sensory, emotional, and cognitive experience that makes it real. For example, your website should be warm, easy to navigate, not sterile and confusing. Your reception should greet couple by name, offer them a quick facility orientation, and make them feel welcome. Your consultation room should feel private and reassuring. Follow-ups should be timely, personalized, and even encouraging as the pregnancy progresses. Each moment adds up to a memorable emotional journey. It's not mere a checklist of medical services. The step 4, structure the delivery. Align your people, process, and technology so the experience is smooth and consistent. Even the best design fails without solid execution behind the scene. Your experience platform is just a facade if you don't have the right people, processes, and technology. Without them, even the best customer experience management will eventually fail. Let's try to understand with an example. Your reception, clinical team, radiology, billing, and insurance desk should all have a real-time access to patient information. No repeating their names, no resubmitting documents 2-3 times running here and there, and for the flows for the signature. Automated appointment reminders, integrated health records, clear hands-off make their journey stress-free and trustworthy. Structuring delivery turns promises on paper into a real experience in practice. Step 5. Continuously innovate. Patient expectations evolve fast. Innovation isn't about expensive technology. It is about constantly improving small movements that matters. Let's take an example. A hospital could introduce a pregnancy journey app with a trimester milestone, test reminders, FAQs, and emotional support resources. Or you could send a personalized video message from the care team for delivery, easing the last-minute anxiety. If you're serious about improving the patient experience, and here's what we need to do for start. Firstly, create a customer experience management task force. Bring together the people from clinical team, admin, IT, and marketing. Break the silo. Own the patient journey together. This is a one-step creating the cross-functional team, how your organization approaches towards patient experience. In the next episode, we will talk about the first step in depth, how to realize, analyze patient experience and uncover the insights that matter. Hey, I'm Vishwanand, also known as Vishy. This was the episode 2 of Healthcare Customer Experience Management Playbook. If you found this to be useful, follow along. Let's rethink healthcare experiences one journey at a time.